kickoff of the Maryland Stop Overdose Strategy, or Maryland SOS. We're deeply honored to be joined by Lieutenant Boyd Rutherford, who will tell you all about this exciting campaign. We're also honored to be joined with Baltimore County Executive John Oseski, who will be telling you about the great work that they are doing here right in Baltimore County to reduce overdose fatalities. I also wanted to thank Drs. Jones and Braithwaite and for the library, the Essex Branch Library, for graciously hosting this event this morning. I also want to thank everyone who came out, especially members of the Baltimore Opioid Intervention Team, as well as providers and any peer support specialists. Thank you all for your hard work and dedication to the opioid crisis. And without further ado, please join me in welcoming Lieutenant Governor Rutherford.
Thank you, Robin. It's great to be here this morning. As Robin said, it's great to be joined by County Executive Olszewski, as well as, of course, Robin, who is our Executive Director of the Opioid Operational Command Center, Dr. Jones and Dr. Braithwaite, both representing the Department of Health, as well as our local partners. And you may want to ask, why are we having this event here in the Essex Library? But the library is a safe place for a lot of people. And often when you think of people who are in recovery or need services and may not be quite ready to go into treatment, they may come to the library as a warm place, a place where they can just relax, not be threatened, but it could be a place where you can actually reach someone who may be ready to make that change and ready to get help. And so today we're launching the Maryland Stop Overdose Strategy, Maryland SOS, a new comprehensive strategy to reduce opioid overdoses and fatalities in our state. In 2019, we saw in Maryland a decline in the number of opioid deaths for the first time since the crisis started. And that was a 1.1% drop in drug and alcohol fatalities, brought about largely by a decrease in the usage of heroin and fentanyl. Oh, by the way, I should have recognized Delegate Mexer, who his phone reminded me that he was here. I'm sorry. Good to see you as always. So we did see a reduction in the use of heroin and fentanyl. And by all accounts, our strategy, our comprehensive approach to address this issue through education, intervention, and treatment was working. However, 2020 happened. And unfortunately, we saw fatalities for opioids and alcohol. Unintentional deaths increased by 18%. The coronavirus pandemic, forced many of us to deal with a number of new and significant economic hardships, trauma, and social isolation. And for more than a year, we've all struggled with these overwhelming circumstances that took us away from family, friends, coworkers, and others in our community. And those struggling with substance use disorders were also disconnected from treatment, from their support networks that have always been integral to their recovery. Now, this new data, or I should say the data that's being released today by the Opioid Operational Command Center and the Department of Health, shows the impact that the pandemic continues to have even now into 2021. From January through March of this year, we saw a 5.7% increase in opioid-related fatalities when compared to the same period in 2020, which that period was just before or as the pandemic was starting to take effect. And so seeing the increase in these deaths in our state, it is alarming, and it shows that we have a long way to go to address the issue of opioid usage, opioid abuse, as well as the fatalities. So as the crisis has evolved, so must our response. Our administration remains committed to putting the resources into and the support services in place at every level to help those struggling with substance use disorder. The Maryland Stop Overdose Strategy is a new layer in our comprehensive statewide response, and we're determined to do everything we can to reduce those overdoses and the deaths in our state. At the beginning of the new fiscal year, $4 million in grants will be given to each county and Baltimore City to support local prevention, enforcement, and treatment initiatives to address the unique needs of each jurisdiction to successfully combat this epidemic. Decisions about that funding, or in terms of where that funding will go, will be made at the local level by the opioid intervention teams who understand the unique needs of their communities. Initiatives are in line with the priorities and goals of the Maryland Interagency Coordination Plan. Here in the county, here in Baltimore County, they will be utilizing those funds for peer recovery support services, including harm reduction and treatment. We're also continuing the conversation with Marylanders about what they feel is needed to help in their communities amid this crisis and to save lives, and to address those who are struggling with the disease of addiction. Beginning in August, state and local leaders will be hosting regional Maryland SOS town halls to address the hardest hit areas of our state. Now, we want to hear directly from Marylanders so that we can better understand what will work and what may not work as well. The Heroin and Opioid Emergency Task Force, which I chaired a couple of years ago, employed a similar model for regional meetings, and we were able to gain valuable insights from individuals on the ground in terms of the challenges that they were facing in different parts of the state. The experiences that those Marylanders had shared with us helped to guide our thinking and decision-making as we mapped out a new process or a process for addressing the issues of addiction. Now, we have a new tool available to us, the Opioid Restitution Fund, which is a fund that was established in 2019, and it's supported by funds that Maryland received as part of legal action related to the opioid crisis. Maryland received $12 million earlier this year, and it's only right that we utilize that funding to address the needs of those who are suffering from opioid addiction. The state's approach to combating substance misuse and the growing number of overdose deaths is truly an all-hands-on-deck approach, requiring us not only to address the problem, but to look at the underlying causes and effects that may not always be considered. The Opioid Operational Command Center and the Maryland Department of Health are working together on what is known as Data-Informed Overdose Risk Mitigation, or DORM. This project examines the prescription and treatment history of individuals whose death involved substance use to identify those individuals who may be at high risk of overdose, as well as what interactions the person had with the various support systems, both at the state and local levels. Director Rickard will have more on this project in a moment, but our hope is that this collaboration and analysis will yield new information, allow us to address gaps in service, and connect us with individuals in a meaningful way that save lives. From 2017 through 2019, deaths connected with opioids decreased by 11.5% for non-Hispanic white Marylanders. However, for non-Hispanic African-American Marylanders, deaths increased by more than 40% during that same period of time. This stark difference presented data that drives home that the systems that we put in place to reduce opioid-related deaths for everyone is not reaching everyone. The new Racial Disparities Task Force, co-chaired by Drs. Jones and Brathwaite, and are operating under the Interagency Coordinating Council, is investigating factors that can contribute to these racial disparities and overdose deaths, as well as what we can do to address the inequities. I look forward to learning more about the program and the progress of the findings during our next council meeting, which is in July. And as I conclude these long remarks, I would like to emphasize that what we're experiencing now is really the tail end of the pandemic. And we don't fully, we won't fully understand the true toll of COVID-19 for a while in terms of its impact on our mental, physical, and emotional health. In 2021, we made significant strides to reduce barriers to increase access to care for those with mental and behavioral health issues, including substance use disorder. The administration expanded healthcare provider options for Marylanders, kept telehealth options in place that have been a lifeline for many during this pandemic. And there's also, and many of you already know, the 24-hour-a-day helpline to help those who are suffering or struggling with mental health issues at 211, where you can get critical information and resources to help you with situations that you may find yourself in. All of this is key to improving the safety, quality of life, and overall well-being of our citizens. And so again, I want to thank you for being here during this time.
Thank you, Lieutenant Governor. And now, if you would join me in welcoming County Executive John Olszewski.
Good morning, everyone. Thank you so much for joining us today. You know, when someone's in crisis, they send out an SOS. And so I want to thank and commend our partners at the state for responding with an SOS of their own in a way that's very positive and helps us continue to battle this opioid epidemic. I'd like to thank our friends in the OOCC, Delegate Metzger, and certainly Lieutenant Governor for joining us today in Baltimore County for this important announcement. Lieutenant Governor has been a steadfast leader and champion on this critical issue. So thank you, Lieutenant Governor, for your leadership. I also want to acknowledge the Director of BCPL, Sonia Alcantara-Antoine, who has truly hit the ground running since taking on her role here with BCPL. Sonia, you truly embrace the unique role that libraries play in our communities, and we're thrilled to have you as a partner as we continue that work in the weeks and months and years ahead. These days, we know that the challenges we face are magnified, and the COVID pandemic has taken an unparalleled toll on our communities, including on our residents who were already struggling with the disease of addiction. Baltimore County continues, unfortunately, to have the second highest number of opioid-related deaths in the state, and addressing this issue has remained one of my administration's top priorities. I also want to recognize Eric Bromwell, who is our opioid strategy coordinator, helping us in that fight. And that is why, together, we are taking a holistic approach to combating the opioid epidemic. We are fighting stigma, increasing access to treatment, expanding harm reduction services, and supporting people in recovery. Over a year ago, Gaudenzia opened a new treatment center at Rosewood in Owings Mills. That was a first for Baltimore County. We continue to expand harm reduction services like needle exchange programs and drug drop boxes. And we're committed to fighting stigma by educating the public through efforts like offering life-saving naloxone trainings right here at our BCPL branches. And we're also providing peer recovery specialists. These are credible messengers who are best equipped to use their own experiences as a bridge to help connect patients to treatment and other necessary services. I want to acknowledge the workers on the front lines, our nurses, our counselors, our peer recovery specialists, and everyone doing that hands-on work to help people with the disease of addiction. People like Hilu Benea, is that pretty good? Yes. Close enough? Who serves as one of our peer recovery specialists, supervisors. Thank you for all that you are doing at a time when our residents need you the most. And Hilu recently joined us also for a community walk, where we got to engage with residents firsthand about the challenges they are facing. Our county's peer recovery program is supported through and thanks to the state's block grant funding. And so we are so thankful for that investment that fosters trust and helps us save lives. The county is proud to supplement this state-supported work with dedicated partnership of community organizations, including the Torch Foundation, who offer community peer recovery specialists that further enhances Baltimore County's own outreach. And while we are proud of the progress we are making, we remain committed to doing even more. And so we both welcome the state's efforts today, and we will continue developing a path in Baltimore County to achieve levels of care, to develop and build out a hub-and-spoke approach, and to find a way to make more public treatment beds available to those in need. We will continue to do as much as we can to support our neighbors in recovery, because together we can continue to combat the disease of addiction, we can save lives, and we can strengthen our communities. I appreciate the opportunity to be with you today. Thank you.
Thank you, County Executive. And I'm excited to introduce to you Hilu, I know I'm going to get your name wrong, but to talk about some of the great work that peer support specialists are doing.
Thank you, bro. Thank you. Good morning, everyone. My name is Helena Bienet. More complicated than that, but everybody calls me Hilu. And if you forget this, say, hello, Hilu, and I'll answer. Okay, but my name is Hilu. I am a peer recovery support specialist. I'm a person, first of all, in long-term recovery. And what that means to me is that I haven't found it necessary to put any kind of mind or mood-altering substance into my body for a little over 10 years now. Thank you. After over 38 years of total insanity chaos that I've caused myself, my family, the community, society at large, my life has changed as a result of this process we call recovery. And my duty as a peer recovery support specialist, now I talk about the chaos I caused, not because I'm proud of it, I will never be proud of it, but I'm no longer ashamed of it. And that is what keeps me moving forward. As a peer recovery specialist, my duty and all of our duties in peer recovery is to put a face on recovery, what recovery looks like we have. And our team, I have 12 amazing partners at the Baltimore County Health Department and all over the state as well as the hospitals. And it is to lift stigma, to put a face on recovery, to show that recovery is possible. But you don't have to do it alone. There is somebody there. And I attribute that hugely to our leadership. When I first came to Baltimore County Health Department as a peer recovery specialist about 6 years ago, I had a leadership that bought into this 100%, that were allowing us to be able to go out there and do the services, which I will talk about in a minute, with no questions. If we couldn't do it, they allowed us to advocate. So that was huge to allow us to have these grants to be able to provide the services for these folks that are in need of these services. As a peer recovery specialist, in our project is at the Baltimore County Health Department. One of the biggest things we do, as the Lieutenant Governor mentioned, he talked about connections, connecting when people are ready, when they are ready for that moment, you know, when they're suffering through this addiction and want to be there. Baltimore County Health Department, we have 12 peers that are there. We have peers in the detention center. We have peers that work with EMS. We have peers that work with mothers, pregnant women, and all aspects of it. We are mainly a dispatch model at Baltimore County Health Department. The dispatch model, I say, is that we have a reach line, a phone number. It's 410-88-REACH, and we wear it on here. And you might all wonder why I have such a bright. Can you see me? Just want to make sure. Because reaching folks is the most important that don't know we're there. I remember in my early days of recovery in Oakland, I used to walk around a corner to do my thing, and I used to walk by a treatment center I didn't even know existed there for years. and that's what we want to avoid. We want to let people know we are everywhere. Let's see us. We're here. When you're ready, just walk up to us. So at the reach line we have, which we have some flyers, and I'll be able to give you some, is that we have a reach model where we have a phone line that is operated by peers from 8:30 a.m. to midnight, Monday through Sunday, constantly. Saturday, I'm sorry. Thank you. Saturday. I'm hoping. See, that's a wish. Leadership. So it's answered by peers, not a dispatch, not a call line, a call center. It's answered with a peer that can provide services right there, or if not, provide services to connect them. One thing we do is we hear a lot about meeting them there. We do. The most important thing we do is that we don't leave them there, and to continue the services no matter where they're from, what they do, who they are in that process. So the dispatch model is answered from the community they call in, and we have peers. The county has provided us with 4 county cars for our 12 peers to be in dispatch models, to be out in the community with green shirts and be out in the community. If somebody needs support, the dispatch, the peers can go immediately and engage that person, get him into treatment, support, have a little talk to, support them to harm reduction, a wide range of conversations. One of the most important things about peer recovery specialists is not that we come from a place of lived experience. And why is that important? Because it builds that connection. That connection is the most important thing. When I pick up somebody at the detention center and I transport them over to the recovery house, guess what the most valuable time is for me? Not getting them there. It's that hour, half hour I'm driving in the car with them. That's why we don't make just friends. We become very friendly to get that connection going. And so the peers, that's what we do. The reach line is, recently we've had some TV commercials, and people have been calling. I didn't know this was here. So we're asking all your support to promote that as much as possible. Let people know we are here to support them at any time, any given time. Peer recovery support specialists, when we do this, we do it out of the connection. We tell them we're not counselors, we're not therapists. We work with them, and it's amazing as a team. But we're here to be your advocate. When we sit at a table, we're going to come from I believe in their self-efficacy, that you can do this, but we're here to support you. We let them know that, we're not responsible to you, but we're responsible to you, but not for you. But we walk with you and show you, if I can do it, you can do it. And that is no doubt. It is extremely possible to recover and live well and get well for long periods of time for mental health as well. It is proof it is possible. It takes time and patience, and we walk with them. We talk about how do you eat an elephant, one bite at a time, and we do that with them. Because when they are released from detention center, with all the stuff that's going on, they want to solve everything going here. We figure out a system with them. How it worked for me when I got together with a peer recovery specialist in 2013, helped me take one thing at a time. And when I veered, helped me get focused back and show me that it can get well. And when I did fall back a little bit, it reminded me how I succeeded, didn't penalize me, didn't put me down, was able to say, I understand, what can we do next? So we focus on what's strong and not what's wrong. We look for the strengths first and understand what has happened, but we focus on what's going on right now. I really appreciate all your supports and continued support. We will be looking for you, for your support continually, and we are here. The reach line, please don't hesitate to, we have some flyers back there, and it kind of gives you a little information about everything. It's 88 reach line, and reach stands for recovery, education, advocacy, community, and health, and that's what we focused on. Okay. Thank you very much.
Thank you, Hulu. And before the press conference, we were talking, and he was telling me that peers will actually be going into the drug courts, that you're going to have a drug court in Baltimore County very soon. Very, very excited about that. So thank you. And also thank you, County Executive and Lieutenant Governor Rutherford. This is such an important initiative, and we're very, very excited to work with everyone as we move forward. Before we wrap up this morning, I just want to leave you with a few brief updates from the Opioid Operational Command Center. First, as the Lieutenant Governor mentioned, we will be releasing our first quarter overdose fatality report and the DORM, the Data Informed Risk Mitigation Report, following this press conference. You can see both of these reports on our website, beforeitstoolate.maryland.gov. The goal of DORM is to link data on opioid overdose victims in order to establish overdose risk profiles. By examining how people are interacting with our state systems, we can identify ways to help them to meet their needs and ultimately save lives. Data was collected from the Health Services Cost Review Commission, Prescription Drug Monitoring Program, Maryland Medicaid, Public Behavioral Health System, programmatic data from the overdose response programs, and others. Just a few key findings from the report include 70% of individuals who died from an overdose had an interaction with a Maryland hospital in the 4 years preceding their death. 60% of people who died from an overdose in Maryland had also been prescribed a controlled substance at some point during the same 5-year period. There's a lot more data presented in the report, and there's a lot more work that can be done as part of this initiative in the coming year. And we look forward to sharing all that information and our findings as we move forward. Also, as the Lieutenant Governor mentioned, the OOCC will be announcing our block grant awards for fiscal year 2022 later today as well. These awards are given to local jurisdictions to provide a base level of funding to combat the opioid crisis. They are also distributed proportionately to the jurisdictions hit the hardest by the opioid crisis. The funds are directed by the local opioid intervention teams, or OITs, as the Lieutenant Governor said, in each of the Maryland's 24 local jurisdictions across the state. And each OIT determines how to use its funding based on its own needs. There are some really good block programs. I was looking at the list that are going to be funded this year, including peer support, not only just in this county, but in several counties throughout the state. Education and prevention campaigns, mobile crisis, transportation. We're hearing that transportation is an issue, and school-based intervention programs, just to name a few. And in the press release, there'll be a link with all the list of the block grants. Additionally, we're in the process of reviewing over 90 proposals for our competitive grant program. Our grant scoring committee is exhausted right now, but they are currently reviewing the proposals for all the projects, and they're designed to reduce, again, opioid-related morbidity and mortality across the state. Between these two programs, the OOCC will distribute a combination of $10 million in the next year to help meet the urgent needs across Maryland. We'll announce our competitive grants awards once the grant scoring committee has completed their work, so stay tuned for that as well. And lastly, just to repeat what the Lieutenant Governor said, if you or someone you know is struggling with mental health or substance use disorder, please, please, please contact your local health department. Call 211, press 1, or you can text 898-211. There are so many caring, passionate, and hardworking people who want to help you or your loved one, because one life lost is too many. And before I conclude, I just want to give a special thank you again to the administration for your leadership and your commitment to the opioid crisis as well as the mental health. And also a special thank you to my OOCC team. I know they're all here. I'm very honored to work with all of you, and your dedication is very much appreciated. Fentanyl is a strong and dangerous drug, and too many people have died. Together with our state, local, and community partners, we're going to keep fighting this fight. Fentanyl is strong, but we're Maryland, and us Marylanders are stronger, and we're going to win. That concludes my remarks, and thank you all for joining us today. And with that, we would gladly take a few questions. I think we have a few minutes.